My name is James Irwin. I'm a cardiologist and electrophysiologist at St. Joseph's Hospital. Well, I'm proud of our Center for AFib, and it was developed by myself and Dr. Lazara, who's a cardiac surgeon who was here at St. Joe's at one time. And at the time, AFib was poorly understood. It was difficult to treat. Physicians were frustrated by the results with medications. Patients didn't have a good understanding, and there wasn't a whole lot of research going on. And so the Center for AFib was designed as a patient education tool. We have community outreach seminars that educate patients about what their treatment options are. We educate physicians about what the treatment options are. We provide state-of-the-art treatment for atrial fibrillation, and it combines research so that we can stay on the cutting edge. Not just catheter ablation, but we did some of the research trials on minimally invasive surgical AFib ablation. We were a leading training site for thoracoscopic AFib ablation. We were one of the centers for left atrial appendage closure with the Watchman, which is a way to eliminate the need for Coumadin even if you're still in AFib by getting rid of the appendage. Again, there's so much in AFib, and there's so much more that we need to do, and it's exciting to have the opportunity to do that. St. Joseph's has been very good to me in allowing me to spread my wings, to bring all of this technology in, and has been very supportive all the way along to help both the community, the hospital, the physicians in our community. We were the first in the nation, or first in the state of Florida to do radiofrequency ablation. We were the third in the nation to get a 3D mapping system, the ESI system. Cryo is a form of energy that we use here a lot. We were the first in the nation to order it. We were actually the 8th in the nation to actually have it. So we've managed to stay on the cutting edge of everything, and it's the exciting thing of what I do. Because of our experience, we're involved in designing catheters for the next generation. We've come a long way in AFib, but we're not completely there yet. And being recognized as a major center, I have my finger on the technology, and we're directing the technology for the next stages. So as excited as I've been with the cryoballoon, I'm looking forward to advancing the technology to go beyond paroxysmal to persistent and chronic AFib. It's an exciting time. It reminds me of when we started doing catheter ablation in 1990. We were the first in the state to do it. We led the way, and we're leading the way now with atrial fibrillation.